Hi everyone, my name is Serena Subedi and I'm an 8th term OTD student at the University of St. Augustine for Health Sciences in Dallas, Texas. This is the first video out of 6 I have created for my program focusing on addressing health literacy and occupation-based education for healthcare providers serving the Hispanic population. Before we begin, I just wanted to say thank you so much for taking the time out of your day to participate in my program. The modules I have created are easily digestible, short, and sweet, as I understand how valuable your time is. Additionally, in each module, I will be teaching some terms in Spanish to assist in the communication with your patients. However, I'm also learning as well, so let's learn together. I would like to state that the Spanish terminology I am teaching, I have learned from individuals who are fluent in Spanish. So now let's begin Module 1 by introducing the program and learn some greetings in Spanish. So the program's goal is to improve confidence in addressing health literacy barriers when working with Hispanic American clients, to promote client-centered and culturally relevant care. So what is health literacy? According to the Centers for Disease Control, or the CDC, it is the degree to which individuals have the ability to find, understand, and use information to inform health-related decisions and actions for themselves and others. Rather than understanding the information that is provided, health literacy emphasizes an individual's ability to utilize health information. In addition, understanding basic health information impacts the services needed to make well-informed health decisions. So here's a little background on the topic. A study done by Sakar in 2015 found that Hispanics have the lowest levels of health literacy among all racial and ethnic groups. Approximately 41% of Hispanics have below basic health literacy compared to 25% American Indians or Alaskan Natives, 24% non-Hispanic Blacks, 13% Asians and Pacific Islanders, and 9% non-Hispanic whites. In addition, it was found that low health literacy within the Hispanic population is associated with the lower use of preventative tests and healthcare services, and they also have higher scores of depression and incorrect medication use. So the program will consist of 6 modules. In Module 1, which is this one here, is the introduction and simple greetings in Spanish. Module 2 will discuss cultural incompetency and cultural humility. Module 3 will discuss health literacy in Hispanic population. Module 4 will be about the Hispanic culture and customs. Module 5 will discuss the methods of addressing health literacy barriers. And lastly, Module 6 will be a summarization of each module. Additionally, each module will include a mini Spanish lesson at the end of the video. However, these modules will possibly change over the course of time, as I may find things that will be beneficial for the facility. Now onto the Spanish lesson. Let's start with greetings. The first one is hola, which means hello. Second is ¿cómo estás?, which means how are you? Next is buenos días, which means good morning. Buenas tardes, which means good afternoon. And buenas noches, which means good evening. And lastly, adios, which means goodbye. I have included a pronunciation column that hopefully helps with pronouncing each term. And these will also be included in the next Spanish lessons as well. Next, we'll learn honorifics. So the first one is señor, which stands for Mr., and this is used for males who are between the ages of 20 to 59 years old. Señora stands for Mrs., and this is used for females who are married or 40 plus. Señorita is Miss, and this is for a female who is unmarried and who is under the age of 40 years old. And lastly is amigo, which is friend. And now we'll be on to the medical professions. The first one is doctor, and that is a male doctor. Doctora is for female doctor, and terapia ocupacional is for occupational therapy, and terapia física is for physical therapy, and lastly, terapia del lenguaje is for speech therapy. So now that we have learned the basics, let's practice using them into a sentence. So let's say, hello, my name is. Hola, mi llamo Serena, which translates to, hello, my name is Serena. And then, of course, you can fill in my name with your name. Next, let's introduce your occupation. So if you were an occupational therapist, you would say, soy terapeuta ocupacional, which means I am an occupational therapist. And then if you are a physical therapist, you would say, soy fisioterapeuta, which stands for I am a physical therapist. And then you can also say, it isn't on here, but if you are a doctor, you could also say soy doctor or soy doctora, which translating to I am a doctor. Lastly, it is now time to end the treatment session. So we would say, adios, hiciste un bien trabajo hoy, which means goodbye, you did a good job today. Or another one you could say is adios, que tengas un bien día, which means goodbye, have a good day. Okay, so you made it through Module 1. I also want to note that though you are learning Spanish with me, this does not mean you do not need a translator. The knowledge that you are gaining from this program should be used to build therapeutic rapport and in collaboration with professional interpreters. So I'd like to thank you for participating in the program and making an intentional effort to address health literacy barriers and understand the Hispanic population a little bit better. So again, thank you for watching and please keep a lookout for the next video. Gracias. Adios.